A few weeks ago, we had Dr. Mark Opperman in the studio to chat with us about obesity. Now, as always, when Dr. Mark visits, you, our viewers, have many more questions. So we have invited Mark back to the show so that we can delve deeper into what needs to be done to manage and overcome this disease. So Mark, welcome back.
Thank you.
Now, last time we spoke about obesity being more than just an eating problem. It's a weight problem. It's an unusual or abnormal accumulation of fat in the body. But now, how do we go about managing it or dealing with it and even overcoming it? Because you mentioned that it's a chronic disease as such, so it's not just about changing the way you eat.
Michael, it needs to be an holistic approach. I see so many weight loss clinics jumping up and, it's all about calorie restriction. You can eat this, you can't eat that. What we need to understand is for you to effectively lose weight, you need to treat the underlying metabolic illnesses or health conditions,
right.
Whether it be elevated cholesterol levels, whether it be insulin resistance, whether it be diabetes, thyroid issues, and then obviously your nutritional deficits. And here we're looking at things like iron, vitamin D, B vitamins, vitamin C, other trace elements. You need to prepare the body, but more than anything else, you need to prepare the mind.
Okay.
It's difficult. We always thought of weight loss as willpower, but you know what, now we know it's no longer willpower, it's actually biology.
Okay.
So you need to look at it from a biological perspective and not just, I'm not going to eat, because you will fail.
Right, right. So Mark, being classified as a disease and a chronic disease to boot, I mean, are there medications that we would be taking to assist us in this process? And I'm not talking about these fad things that just going to sort of quash your appetite and they're not healthy medications as such. But are there things that can help to kickstart this process and get us moving in this way?
Michael, I think when we look at medication, specifically for weight loss, we need to understand that there's been weight loss medication in various forms for many years. I think most of our older viewers will remember the old appetite suppressants. Basically, it was a stimulant, and that stimulant suppressed your appetite center. It was like taking party drugs,
right.
Basically. And then they evolved a little bit into medications that stops the absorption of fat, but with that came a couple of nasty surprises, nasty side effects. And in the past couple of years, new types of medications came onto the market. And here we're looking at your GLA agonists, and these are medications specifically developed for diabetics. When we started using them in the diabetics, we noticed that these guys are losing weight effectively without the severe effort that other people had to put into their diets. And these medications work on different hormone systems. Okay. So it's hormone manipulation.
Right, right.
Where we look at Grenin, we've spoken about Grenin on this programs before. Grenin is the hormone that is released from the stomach and tells the brain that you had enough food to eat. So it works by making you feel full quicker.
Okay.
And that medication also works on slowing the emptying of your stomach. So your stomach feels full. Just think about when you've had a big glass of water.
Yes.
You can't eat a whole hamburger. You eat it in stages. So it slows down gastric emptying. And then there's other medications that work on leptin levels, etc., etc. But it really is a combination approach between prescription medication and lifestyle changes. And when we look at the lifestyle changes, what number one is diet.
Yes, absolutely. I mean,
Eating the correct types of foods. It's not the quantity of food that you eat. It's the type of food that you eat. So it's all about the nutritional value that you get, not necessarily the energy value that you get out of these things. And here we're looking at your fruits and your vegetables, legumes, nuts. Whole dairy is actually brilliant for you from a cardiovascular perspective as well as from a weight perspective. Decrease in your red meats. In other words, the stuff that you cut out of your diet are sugars, and these include all the carbohydrates, all the refined grains, which you find in bread and pasta and cake and all those kind of stuff, salt and fat. The studies that has been done on these medications, liraglutide, semaglutide, all show that within a year of stopping this medication, if your lifestyle hasn't changed, you will regain the weight.
Right.
So remember, it's a chronic disease.
Yes.
So you have to manage it as a chronic disease. So lifestyle changes include not only diet and physical activity. And if we stand still at physical activity, for children under the age of 16, it's 60 minutes of physical activity per day. And for adults, it's 150 minutes spread over a week.
So much less for adults. It's not a huge amount.
Remember, for kids, you also have movement as development for the neurological systems. But it's also about changing stress, managing stress. We know what stress do in the body. It increases cortisol. And cortisol is going to release glucose into the bloodstream. And like we spoke in our first episode on metabolic disease, if I have more glucose, I'm going to make more insulin.
Yes.
And insulin is pro-inflammatory. So it causes inflammation, which leads to damage and other problems. Also, sleep. You need to have decent quality of sleep. And it's not about the amount of hours that you sleep, but more about how good you rest during sleep. So the simple question is, if you wake up in the morning, are you rested? Do you wake up and say, oh my God, I feel so great, I had such a nice sleep, or not? We need to take a look at the complications of obesity. Now, I think most people know that it can create hypertension, and it does that in different ways. Excessive fat in the blood, excessive fat in the tissue, it increases blood pressure, and it leads to heart attacks and strokes. Diabetes, which we understand because that inflammatory process, insulin not working, leads to diabetes. But the ones I think that people forget is cancer.
Absolutely.
Obesity is associated with a far higher incidence of cancer. If we look at the cancers in women, the ones that everyone are afraid of, it's breast cancer, endometrial cancer, and ovarian cancer. Men, prostate cancer, far higher incidence.
Right.
But then you also have the other ones, colorectal cancer, pancreatic cancer, liver cancer. So, it's not only that you are not healthy, but you're putting yourself at risk.
Yeah.
For your musculoskeletal system, and obesity is really, really detrimental because that excess weight damages joints, and excess weight, because of the inflammatory response, also weakens bone. So you have a higher risk of osteoarthritis, rheumatoid arthritis, and other autoimmune diseases, but also a higher incidence of fractures.
Yeah.
Again, obesity is going to impact sleep through causing apnea or obstructive breathing. it's understanding all these fundamentals, because you need to incorporate all of that into your protocol to effectively lose weight sustainably
Yeah.
and keep that weight off.
I mean, Mark, when you talk about these things, it's actually incredibly scary what the impact of obesity can be, and it's a long-term view that people need to be taking in terms of basically getting their lives in order to prevent these lifestyle diseases.
Michael, absolutely. I think when you're young, you don't think about the future. The problem is now we're going to live longer whether we want to or not.
You want to be in
But
good condition.
doing that in a healthy way is going to become a problem. I think social economic circumstances, like we spoke in the previous episode, where your access to good quality nutritional food becomes more difficult, you will have to do other stuff. Obesity is a pandemic of epic proportions. If you think COVID was bad, this kills far more people on a yearly basis.
I want to touch very quickly before we are almost out of time, but hormones as well. You've mentioned the leptin, the ghrelin, the cortisol, things like that. I mean, what are the other hormones that are implicated or disrupted through being obese?
So many. But for women when they go through menopause, for men when they go through andropause, you have that middle age spread. And that's because of dysregulation and inflammation. We know that estrogen and both testosterone and anti-inflammatory. But there's a lot more to that, your neurotransmitters. We know that diet has a great effect on the brain and mental health.
Yes.
So here we're looking at not only the body dysmorphia or the body shaming that happens, that causes depression and anxiety and stress, but also dopamine and serotonin and all of those. Lower levels of dopamine is associated with neurological dysfunction and neurological disease, Parkinson's, Alzheimer's, dementia. There's new hormones that are being discovered. We knew about 50. I think in the last year alone, there's been 10 or more hormones,
Really?
and all of them has to do with metabolism. Most of them are completely reliant on hormones. So we're discovering more and more of these hormones that affect metabolism, weight, and inflammation. And I think those three go hand in hand.
Absolutely. Mark, it really is fascinating stuff. Anyone who would maybe like to consult with you, embark on a weight loss journey, or generally just for a health check, deep dive to see what's going on in their bodies, how can they get hold of you?
I think the easiest is our website, www.thetclinic.com, or call us in Johannesburg on 010-824-1393.
Mark, always great discussing these
Thanks,
things with you.
Michael.
Thank you for coming in.